I mean, you're not just seeing like one patient at a time. You guys are trying to triage. You're trying to rely on your staffing to get you in the right situation, the right time to make the right decisions. Talk about, ask you a follow-up question, Kelsey. Talk about just how the importance is of having like a good staff to allow you to do your job to the best of your ability.
Oh, it's huge. And we're so lucky at Edward. We have the most amazing nurses and techs and radiology staff and just support staff and other docs too. But we really work as a team. We count on each other. So, you know, if Dr. Wilson or I were stuck in a room with a patient who was critically ill, say they were having CPR done to them and needed to be intubated and needed a procedure, you know, we may be in that room for 45 minutes to an hour straight, which in the ER is an eternity. And so all the other patients have to wait for us. And then also we rely on our nurses to take care of that. So say someone came in with a kidney stone while that was happening, our nurses would put in an IV, they would order labs, they would give pain medicine, so that person's not just sitting there suffering for an hour while we're taken away by another, sadly, more critical patient. So, I mean, the ER is such a teamwork environment. We really count on each other to fill in the gaps and just all do our jobs, and it really runs like clockwork when that happens.
You know, when I think about ER, and the last time I was actually seeing patients in the ER was when I was a medical student doing an ER rotation. I just joking. I did a little bit. Well, I would come down before I give my inpatient duties at the hospital. I come down and see you guys in the emergency room and see my patient as they're about to get admitted to the hospital. But one of the things that I always thought about as a physician, as an internist, the amount of like protocols that are out there. I mean, you guys have to run like a well-oiled machine, and so you guys have been trained, and going back to like, again, 30, 40 years ago, it's so much more regimented, but you're able to do so much because of those protocols. What's your thoughts on that, Dr. Wilson?
Well, that's the key thing. That helps us. I mean, if you look at the typical day, as Kelsey's explaining, it's like spinning plates. And really, you have to have, you know, we can spin those plates. We know how to do that. We've been trained to spin plates. But, you know, plates sometimes start to fall. And having a multitude of individuals around you to try and keep those plates from crashing to the ground is super important. And having a protocol in place that says, hey, if plate number 6 is spinning and it's wobbling, I need you to put that plate back up a little bit or take that pole and move it this way. That's going to keep all those plates from falling down. So having protocol-driven care is going to be key. You know, having, you know, computer-driven systems so that we can have stops that will keep us from making a medical error or making us, you know, not look and see that this patient requires something different than where we're going. That helps us to keep our brains kind of focused on things because we have all these distractions that are pulling us away. I mean, it's not only just seeing the patient here who's critically ill. A patient who might not be that ill here, a new patient coming in we need to assess. Sometimes you're getting phone calls back from your consultants that you need to go back and talk about the patient 5 minutes ago that you were just thinking of. And then you get another thing from a tech who's telling you that they need you to check on a splint, or you have another distraction from another phone call from someplace else. It's all these things that are there that are taking you out of your kind of focused mindset. So we have to be able to take all this kind of almost anarchy and entropy and keep it focused. I mean, and if you think about it, that's kind of the whole thing of insanity, if you think about it. I mean, everything moves towards randomness, but we're constantly taking things and trying to put it back into order. And so that is, it takes protocol. It takes, you know, a way of doing things that has to be driven down a line, that you don't step out of that line in some sense. Yeah, you can think outside of the box and you have to, but you have to be able to do that in a regimented fashion so you don't skip things. And because if you do, that's where we make errors. And a part of what we do in our day is working with limited information lots of times. And we have to be able to make a leap of confidence to say, this is what we're doing. And really, if you think about what a good ER physician is, it's a person that can make decisions and be definitive in their decisions and say, I'm doing this because this is the best thing to do right now with the information I'm provided with. And you may be wrong, but you have to say, that was the best thing I had, and I move forward with that. And that's a big thing that makes a good ER physician, is that you're confident, and you have to be confident in the face of having limited information at times.
I think about just give the facts. You know, that's one of the things I talk about to people, even to my patients, when I say, hey, you know, if you go to the emergency room, I hope you don't ever have to go, but when you go there, give them the facts, because they're there to help you without a doubt. They'll help you to move from point A to point B, and hope that point A to point B is coming right back to me just as healthy as you were, and et cetera, and things like that. But you know, we gotta just do it like that. So I think it's, again, you're talking about the regimen and stuff, and I think that's huge. And medicine has been more, you know, Dr. Wilson saying, you know, you have to kind of think outside the box. Medicine does still allow you to think outside the box, but
Yes.
but having those kind of protocols, even in internal medicine, primary care, we have our protocols because we know they work, but we refine our protocols.
Mhm.
And I think that's what you guys have done over the years. So let me ask you this question, Dr. Flanagan.